Hello, I'm Dr. Shawn Phelan. I'm here to talk with you today about plantar fasciitis. Very common condition that can affect our feet in athletes or just individuals that are working on hard surfaces. And what it is in effect is the inflammation of the connective tissue on the bottom of the feet. Methods of treating it include rest and ice, include taping of the foot, orthotics, massage therapy, cortisone injections. What we really need to understand is the origin of it, where it's coming from, so we can fix it perhaps even by ourselves. And where it's coming from is wearing footwear, walking on hard, flat surfaces, destroying the arch in our feet with improper footwear itself, and then creating inflammation of the plantar fascia. We need to understand how the foot is designed. The foot is designed with about 25% of the joints and bones are dedicated to the feet. 25% of the joints and bones in our bodies is dedicated to the structures of the feet. That being said, the foot is perfectly designed to handle our weight and gravity, to propel us, to support us without the use of footwear. That is what it's designed for. Now, what we do is we put our feet into shoes, we walk on hard, flat surfaces, and the muscles in the feet, the connective tissue in the feet begins to weaken and break down. We need to understand what the plantar fascia is, and it is a connective tissue that is on the bottom of the foot, which provides us with support, and it also provides us with the information about what's happening in the feet. It's very pain sensitive. The foot, again, was designed for use without a lot of support. In the first illustration here, you can see the foot itself with all of the bones and the articulations that are associated with it. The second illustration shows a picture of some runners, one of which was a runner named Zola Budd, and she ran in bare feet competitively. She was a high-level athlete that competed in bare feet. The next illustration is a picture of the plantar fascia itself. You can see it on the bottom of the foot with a person that's beginning to go through a stride there. The next illustration is a picture of the plantar fascia providing some support to the arch in the foot. Now that is the longitudinal arch, and it is very important. It is the arch that tends to collapse. It is the arch that tends to be associated with flat feet. And in the next illustration, you can see a footprint, if you will, of 3 different feet. The one on the far left would be considered fairly normal. The one in the middle would be considered a flat foot, or a foot that is pronated. And the last is a foot that has a very high and rigid arch. Those are the imprints that they would make if the person stepped on a piece of concrete, say with a wet foot. That's what you would see. Now that plantar fascia is providing the arch support in the foot, and arches are just that. They are designed to support downward forces from above. If you want to break an arch down, you press up on it from underneath. And when you press up on it from underneath, the arch loses its integrity, and then other structures have to support it. So when we are wearing the modern running shoes, when we're wearing shoes with very supportive arches, what we're doing in essence is artificially supporting the arch, breaking down the integrity of it, and allowing the plantar fascia to take more abuse. So we have to be very careful with the type of footwear we use and the aggressivenesses of the arch that we're using in them. Can you improve your arch once they do start to collapse? Can you improve the arch? Can you get rid of the plantar fasciitis? These are the questions that people ask when they come in with foot pain here. And yes, you can improve the arch, and yes, you can get rid of the plantar fascial pain. The way we do it here is by using a combination of the methods that were mentioned earlier, the rest and the ice, taping to support the foot, orthotics when that is necessary, massage therapy, and once in a while we have to send them out for cortisone injections. But recently we're starting to get people to get outside and train more on uneven surfaces, on trails, on surfaces that are not flat and even, in as close to bare feet as they can get. Vibram makes a product called the 5-Finger, and it is a running shoe essentially that looks like a rubber bootie that has toe articulations in it. Here's a picture of that. We are taking our triathletes and our high-level runners and moving them off of the hard surfaces, out of the high supportive running shoe, and moving them onto the trails in these running shoes themselves. This is a video here that we shot of a running clinic that we did recently, where we had a group of trainers and therapists that participated in one of those barefoot runs, if you will, through 3 miles of trail. And they were out there in order to learn how to do that to coach their patients. The barefoot running is a technique that is coming to the forefront of running itself. And it is helping us to restore some of the arches. It is helping us to rehabilitate the feet and bring them back to the point where we are walking around in feet that are deconditioned, that are tired, that are painful, that are falling into disuse. If you have any more questions about this, please visit our website and or get in contact with our office here at wakeforestchiropractic.com. Thank you.